35 weeks pregnant. The baby's coming any day now. All right, so let's work low back today.
Okay.
We'll do our standard upper back treatment to right side neck. Have you had any headaches the past 3 or 4 weeks? Still doing a lot of computer editing? And
yes.
Last adjustment was really nice. Neck adjusted really well. Mid back, we will do a low back adjustment, probably a little muscle work in the low back today as well.
Okay.
You guys have seen on Bree's previous videos, she's been here, I don't know, 4 to 6 times throughout pregnancy, and overall doing really well, right? Mm-hmm. Keeping her body stretched out and aligned at home a little bit with hopefully a little bit of exercise throughout the weeks. Feet stretching, toes stretching to help with circulation and blood flow down into the lower extremity, because you've noticed a little bit of swelling in the lower extremity.
Yeah, my ankles are starting to swell.
Which is common in that 3rd trimester. As body has grown a little bit, your weight is up a little bit, the baby's growing. There's definitely more stress and pressure down through the legs, down through the body. Calf raises and foot squeezes and hip stretches, super important to maintain on these last 4 or 5 weeks, however long that little baby chooses to sit in there. Lean your head over to the right for me. Really pull that head over to the right. If you guys have any specific questions about chiropractic care and pregnancy, feel free to drop them below on any of the pregnancy videos. We'll try to get back to them. There are a number of different exercises and stretches that are safe to do during pregnancy. There's a number of different body positions and foot exercises that can help to eliminate or reduce discomfort. Swelling sometimes is common. Different people have different amounts of ankle and lower leg edema, lower leg swelling. But definitely keeping those like lower leg muscles pumping, the feet squeezing and the ankles and the calves pumping. Really important to get that fluid pumping back and forth out of the toes and up back into the legs. All right, now head to left. And then guys, we're going to work on this little band that we see on Bree's right side neck that kind of pulls out right here. And this is the fiber that pulls way up into the suboccipital region. You can probably feel just how you just lean and stretch a little bit. And then we'll feel, as we start with some of the muscle work, we're going to scan for her restriction sites, which once you guys start with chiropractic care, different chiropractors do different things where they might give you a little card where your restrictions are at. Sometimes we don't do anything like that. We just keep it in your EHR now in your notes, so we know where we're typically working at. But really a good chiropractor can scan every patient and just feel where the restrictions are at. Different guys use different techniques though, like there's EMG, I believe it's called. There's different spinal scanning devices that can show you where some inflammation is at, where you get a nice colored printout. We would see on Bree's colored printout that this upper right C1, C2, C3 region is where she commonly will get her headaches, her neck pain, this band of muscle. And you know, Bree has a job on the computer a lot, photo editing and video editing, so it's common to just kind of develop a little bit of shoulder hike on the right side or a little bit of neck compression on that right side. And at its worst, when this area is irritated or inflamed, it can definitely create headaches, neck problems, shoulder problems, reduction of just general well-being or well-feeling. when the spinal cord is kind of like irritated, and Bree, look down for me, as we work on her, she's had chronic headaches in the past, which are now way more manageable with exercises, stretches, and an adjustment here or there to help loosen up the neck. Look down for me, look up for me, look down for me, look up, look down, look up, look down, and then left gently, and then up, down, left, up, down, and left, up, down, and left. One more time. Down, left, good. Head up high, chin tuck back, and then tilt back like there, and then lean left for me. And now lower your right shoulder down. And that's where you want to kind of go, right? Do you see how that kind of pops that thing out right there? That's where you want to go. Just stretch right here, shoulder blade down, sit on the couch, sit at the computer, pull and stretch this fiber right here. As you pull and stretch the fiber, we focus on lat activation down into this side. We focus on gently pulling or tilting the neck to the left side, and she's getting a nice stretch down the scalene region, the lateral neck muscles, the upper trapezius fibers, all this musculature on the side of the neck that kind of comes down here into the side of the shoulder, or the lateral deltoid. And then we're going to go to this left side, nice. And then chin tuck back a little bit, head pulled to the right, left shoulder down. Same thing on this left side, but way less prominent. There's not as much tension. Does it feel easier to tilt this way a little bit?
A lot easier.
A lot easier. So when we talk about imbalance in the neck has to rotate. It slides or it swivels up on the CO, C1, and C2 axis, side to side. And sometimes the head gets a little crooked like this, and then the skeleton, your cervical spine, gets a little imbalanced. So there's a number of different neck exercises, sliding or tilting the head left and right to open up the cervical spine. That's very important, to try to just move your body a little bit throughout the day so you can feel like, oh, I'm so tight, my neck is so painful. Well, let's chill out. Let's open the neck up. Look down for me. Look up. Look down, look up, look down, look up, look down, look up, look down, look up, and look down. Nice job. Way less compression up on that upper left side. All right, stand up for me, and then we're going to go face down on the table. On Bree's previous videos, this is a pregnancy table. It allows her to somewhat lay comfortably on her belly, somewhat. It was easier a couple weeks ago. But as that baby grows, it gets a little tougher as the belly grows.
No, it feels good.
Feels okay? Yay, nice. So guys, what we're doing for her initially, which we do for a number of patients, we start to stretch the toes down and in, the ankles up and out. We get a nice little internal rotation stretch over on the left side and over on the right side. She does not have a ton of imbalance in between her legs. A little bit on the left side versus the right side. A little bit easier on the right side versus the left side, it feels like. The right side bounces a little bit more than the left side. So we'll see if we can get some nice ankle adjustments into here today. But let's first just see where she's at. Perfect movement with the knee pushing to my hand here. And stop. And push. And the rocker that we talked about, push. A while ago, still is acceptable push to do in third trimester pregnancy. Push. The rocker is where we sit down on our ankles, our knees. Push. One more time. Stop. Push. Stop. Oh, right there. Push gently. A little harder. Right there. Push, 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 push. Keep going. So you see how you push right there and you start to shake a little bit?
Yeah.
Stop. Push. That's where you felt that little click in your knee there. Stop. Push. And stop. So I'm going to show you the same thing that we just did with your dad actually. Nice. Okay, we'll get those toes face up too. Sometimes they move well down, sometimes we gotta go up with them. All right, leg up. Push. Stop. Push. Stop. And push. and stop, and push, and stop, and push, and stop. Nice job. Back down. All right, good work. Left leg actually flexes a little easier, but internal rotation wise, the right side's a little, the left side's a little tighter than the right side. The left internal rotation's a little tighter. All right. Here. Let's do a little hip treatment with the hypervolt. A lot of back chain, as you guys have heard in all my videos, back chain stretching. If I catch myself a little bit tucked under, I'm going to work on my hip extension, my back extension, so that I rest in my back chain, maintaining my lumbar curvature. If you see chiropractors or physical therapists that are hunched over the table like this, they ultimately, at some point, are going to hurt their back, whether they herniate a disc or sprain a joint or develop some kind of back pain. Much less likely to develop back pain or injury when we rest in our back chain. And to rest in our back chain, we want to think hips back, shoulders up and forward a little bit, right? So we keep the hips back, we rest in our back muscles right down here. These lumbar erectors get nice and strong. We experience more mobile hips as we rest in our back chain, greater leg strength out of the glutes and the hamstrings, and just overall better body positioning, better body movement as we really work hard throughout the days, the weeks, the exercises that we complete at home or at the gym to make sure that we're really engaging and resting in the back chain. And then we're just using the hypervolt around the hip crest, the ilium. To get some good movement up into the pelvis. Nice job. All right. I'm going to raise this up, okay?
Yep.
Do you have it? Yes. All right.
Raise it down.
Nice. All right. And then, guys, on breathe today, we're also going to do a little low back muscle work, a little bit of myofascial release in your low back. It's common as the abdomen grows, as the baby grows, that our weight shifts a little forward. So sometimes we get this like hyperlordotic curvature where we just get a little too much low back, and then things can strain. The SI joints can get irritated, the lumbar vertebrae or the facet joints down in the low back can get irritated. So as we do just a little bit of muscle work left and right side, we'll be able to help provide a little bit of relief into our lower back. And there goes a little easy adjustment, just with a little bit of pressure. You okay here?
Mm-hmm. Yeah, I haven't had like low back pain until like the last week, probably.
Last week it popped up?
Yeah.
Yeah. And this is common where your pelvis and your ligaments all throughout your body start to stretch. If you have any carpal tunnel or anything, any numbness and tingling, sometimes carpal tunnel in any trimester really can present, but is more common during that third trimester where you can get some wrist and forearm swelling and tightness, numbness and tingling, maybe some burning sensations down into the different regions of the fingers, the hand, or sometimes even in the lower body. And that's just because ligaments are stretching big time, relaxing to allow the pelvis to open up for the passage of the baby. He or she? Or you don't know? She. And is she kicking pretty good, solid?
Yeah.
Yeah, nice. Cameron got to feel?
Mm-hmm.
Nice. Exciting times. You guys got your nursery coming?
Yeah, it's almost finished.
Painted and crib?
Yeah.
Exciting times in 2022. Due date is what again?
December 20th.
Yes, nice. Christmas baby.
Yes.
Well, this month we've had, 3, 4, 5 patients deliver. Usually it kind of comes Kind of comes in waves. I think 3 babies actually. Good. One was a week early, one was a week late, one was right on time. Okay, here we go. Shoulders down, rest them just easy like that. Take breath in. Exhale down for me. Whole way down, nice. One more. Good. Deep breath in. Exhale down for me. Whole way down. Good. Deep breath in. Exhale down. One more. Nice job. Breathe. One more time up here now. Inhale deep. Exhale deep. Whole way out. Rest those shoulders down for me right there. Nice. Okay, face over to window, right side up. Guys, and then we talked about last video with Brie. I think she was about 30 weeks, 31 weeks. As long as you guys feel safe in the side posture position, it's still okay to adjust. Nice. Other side for me. But we're careful, we're not jumping or bouncing on the belly or anywhere around the abdomen. When we do our side posture adjustments, we're trying to get kind of like right here on the hip. So we get the hip to rotate and the spine to rotate this way. All right, here, breath in and out, whole way down. Nice, nice. All right, good work with the lumbar adjustments. Bree, what we want you to do at home, make sure, as we've talked on previous points, foot squeeze. For you, you're going to go through the full range of motion, which is feet up as hard as you can. Think left foot up, think right foot up for about 5 to 10, and then feet down. Left foot squeeze down, right foot squeeze down. Left foot squeeze down, right foot squeeze down. Feet up, left foot pull up, right foot pull up. Easy exercises to help the calf muscles, the lower leg muscles to start to pump back and forth to hopefully pull some fluid up out of the lower body. Both feet squeeze down, left foot squeezes down. Right foot squeezes down. Left foot. Right foot, and then back up. Left foot pulls up. Right foot pulls up. Now you can hang out in this up position and you can really work on this pull up and just try to feel how that kind of stretches and pulls the calves out a little bit, okay? And you can hold that for like a minute or 2 minutes in that foot up or foot down position. And also, as you've been doing, just kind of a lot of stretch pressure on the top of the toes like this as well. Anytime you're at the computer, you should be toes down. Nice. Relax it. Good. Good. And then this side here. And Bree's got nice and healthy feet. Different than some people, but she's got beautiful inversion or internal rotation. And part of the reason why Bree's low back adjusts so nicely is because she's got these nice flexible ankles and feet, which tell us that she doesn't have a lot of muscle overactivation or overuse up the IT bands and the lateral sides of the legs where we get shin splints at. Good. And then one more here. And during pregnancy, some patients like to come in weekly, some patients like to come in every 2 weeks, every 3 weeks. Always better to start chiropractic care before pregnancy so we can get things centered and balanced out, as opposed to during pregnancy. Sometimes patients come in at 35 weeks, which is fine. We're still going to do what we can to get you adjusted a little bit, but you know, by that time there's usually a lot of muscle imbalance present. And elbow, easy. All right, oh, right, oh. All right. Sore in there?
I don't know, we got it last time.
Hand.
I've been like...
Hand. Good. Elbow. This side's good. Right here. Yeah, they're both all tight today. That's okay. Boom. One more. Boom. There we go. Oh.
Okay.
Can we try that one more time? Was this the sore side? You know what, let's do your neck first. Hands right here. And then we'll see if we can get the elbow. Sometimes as we fix the neck, other joints will loosen up. Easy on the left side here. Beautiful. Easy on the right side. Beautiful. All right. Hand here. Let's see this side one more time. It wants it here. There we go.
That feels so good.
Yeah. All right, so what happened there? We couldn't get the adjustment at first through the elbow because this like front line of muscles up into her neck was kind of tightened up, right? And that kind of jams everything up. So sometimes if we can't get the elbows first, we'll clear the neck or adjust the neck, which reduces tension up in the shoulder, and then we can easily get the elbow. Not all the time, but sometimes things work out like that really nicely. Okay? All right. All right, roll to your right, then sit up tall for me. Like this is our goal, guys, with on the YouTube channel. This is our goal with all of our pregnancy patients. We want to get them to move well throughout these later stages in pregnancy. We want to see the skeleton continue to be nice and loose and mobile and flexible. And all that does is set us up for, just for an easier pregnancy. Most of the time, we should have less difficulty if the hips are open and the low back is nice and balanced. The muscles and the legs will be nice and balanced, and we will generally feel better, allowing easier passage of that baby down through. Okay? Stand up for me. All right, guys, so during pregnancy, it's common to have increased swelling, fluid retention down in the lower body. So it's really important that we keep muscles, joints, ligaments, tendons, and bones all moving well. For Bree, who works on a computer most of the day, we're gonna recommend, and you guys have seen this in our foot stretching video, that she, most of the time throughout the day, is trying to do some kind of extracurricular work that can help her body to feel better. We're going to help her circulation to improve and fluid to move up out of the leg. One of the things we want to do is work this arch of the foot where she tucks her toes under and she gently can press down through the top of the foot, and at the same time think about squeezing the plantar fascia a little bit, just kind of like trying to activate that muscle. So you're going to work on a nice consistent squeeze down. As you squeeze the toes down, we're going to point or push the foot down a little bit to really overstretch the top extensor muscles on the top of the foot. After she does this for a period of 3, 4, 5 minutes, we can take the foot out, and then we can work on the bottom foot press and this high foot press like this, where we now push down through that stiff ankle and we start to feel maybe the calf activate. If I say squeeze your calf, see how you can kind of talk to this a little bit? And when I say talk to it, she's using her brain to try to contract the calf. So push strong down through the foot, try to squeeze the calf a little bit. There it is right there. Feel how it kind of pumps on. So she's getting a nice little pump of the muscle, which is gradually helping. When we pump our muscles, it helps fluid to move out throughout the body. So she can transition from the top of the foot and the nice plantar fascia activation and the foot squeeze for a period of 2 minutes or 5 minutes. No time length really matters, to transitioning back to the high foot press. She can do that both feet at the same time if you want to, where we just kind of work gradually on focus left squeeze or right squeeze. And then we can work on the bottom of the feet, and really as she sits on the computer trying to sit in this high foot, this is our go-to foot position. It really helps the ankles to get strong, the calves to get strong, it helps balance out the legs and the hips, and it puts us in a nice seated position that allows us to move better and ultimately reduces some of the discomfort in the lower extremity. Okay? Cool?
Okay.
See you guys later on.